Hi, everyone. We're going to close out lecture 14 by talking about some clinical cases that hopefully illustrate some of the concepts that we learned when talking about control of respiration. The first is when I went to Aspen, Colorado, several years ago. My son was tiny, and it's about 8,000 feet above sea level, which is much, much higher above sea level than Wisconsin, and the air is thinner up there. There's actually much less oxygen. So I want you to take a moment, and I want you to think about what will happen then physiologically based on what you've learned. So feel free to pause the recording for just a minute, test yourself, see if you can figure out, and now I'm going to tell you what happens. Low oxygen levels, right? So it is harder to get as much oxygen into your bloodstream. So you will initially have low oxygen levels. And so those peripheral chemoreceptors in the aortic and carotid bodies are going to send signals to the medulla via cranial nerve 10 and 9. So remember, the central chemoreceptors are not perceiving oxygen levels, but the peripheral ones are. So thankfully, they will let the medulla know, and then the respiratory center will then increase the rate of respiration. So how frequently you breathe, how quickly you breathe until your oxygen levels come back to normal, and then it's going to continue at whatever respiratory rate is necessary to maintain that oxygenation. So that's response to low oxygen levels, which could be due to traveling to altitude, or it could sometimes be due to having, say, a pneumonia or a lung infection, some type of lung problem that impairs your ability to get oxygen into your body. Same thing will happen. Let's say you encounter a scary demon, right? So what happens when you're afraid or excited or nervous or worried or any of a variety of strong emotions? So signals now are going to come from the emotion centers of the brain, which we haven't really talked about a lot yet. You've learned about the amygdala. We haven't really talked about the limbic system yet. And signals are going to come through the hypothalamus, who has its hands and everything, to the respiratory control center, which is also going to increase the rate and depth of respiration. So when you're afraid or worried, you're going to breathe more rapidly as well. So it's also going to stimulate the same response, but because of a different cause. The next case is a child who has what's called diabetic ketoacidosis. Let me break that down a little bit for you. So this is a condition that can occur in kids with untreated type 1 diabetes. Type 1 diabetes is a type of diabetes where your blood glucose levels are high because your body can't make insulin. And without insulin, even if there's plenty of glucose in the bloodstream, the body's cells can't take it into them, and so they can't use it to make ATP for mitochondria. So in order to survive, the cells are going to resort to some other metabolic processes, which are less efficient, but also generate some other types of waste products. So ketones is one of them, hence ketoacidosis. And then we're also going to see extra acid in the bloodstream as well, not due to carbon dioxide, but due to metabolites of these other metabolic processes to make ATP. So think a minute, what is going to happen? Here we go. So low pH, you might remember, will also stimulate the chemoreceptors, both the central ones in the medulla and the peripheral ones in the aortic bodies and the carotid bodies. So they're going to send signals to the respiratory center. The medulla doesn't know if your pH is low, if you have acidic blood due to high carbon dioxide level or to something else, and quite frankly, it doesn't really care. So it's going to increase the rate and depth of respiration. Now, interestingly, this will result in you blowing off more carbon dioxide, which will help get rid of some of the excess acid because carbon dioxide is acidic. But I will tell you that in the case of a child with DKA or diabetic ketoacidosis, it is not sufficient. They need emergent intensive medical treatment. And one of your media assignments is actually a hospital video of a child with just this condition. And you'll see how quickly and deeply they are breathing as their respiratory center is receiving all these signals about how acidic their blood is. And so it's making them breathe really hard and really quickly. that the child's family gave permission for that video to be used, and I also want you to know the child is getting treatment. They did not like wait to start treating the child until after they took the video. The child is being actively treated, which is good because this is actually a life-threatening condition. So just remember, anything that makes the blood more acidic will also make you breathe more rapidly and more deeply. So rapid breathing problems, or rapid breathing, or heavy breathing, big gasping breathing is not always due to problems with oxygen or CO2. So it can be due to anything that makes the blood more acidic, and in which case it's called Kussmaul breathing. So that's what the graphic is talking about. So diabetic ketoacidosis is one of the most common causes of that. There are some other metabolic diseases that can cause increased acid in the bloodstream and cause the same thing. But then, of course, rapid breathing can also be due to emotional stimuli, emotional states, and pain, right? So if you have a patient coming in who's breathing rapidly, it could be a lung problem, it could be a cardiovascular problem in terms of delivery of oxygen to tissues, but it could also be acidosis or an emotional thing or pain. So lots of different causes of rapid breathing when somebody comes in to the emergency room, say, with that problem. Our last case is a high spinal cord injury. So Christopher Reeve was a very famous actor. I saw him when he starred as Superman when I was a child, so a long, long time ago. And later in life, he actually was horseback riding, fell off the horse, and had a terrible neck injury, complete injury of the spinal cord at C2. So very, very high spinal cord injury. So remember the spinal cord, and I want you to take a moment and think about what would happen in a patient for whom this occurred. Here we go. So complete loss of motor and sensory function from that level down. So complete paralysis and loss of sensation from the neck down. And this is going to include paralysis of the diaphragm, because remember, the roots to the phrenic nerve come from C3, 4, and 5, which are all below the level of the injury. So there's no ability for the medulla to then communicate and send those signals. Those axons now have been disrupted, so you can't get those signals out to the diaphragm. So individuals who have this type of spinal cord injury, one, as soon as it occurs, they are no longer breathing. So he is very fortunate that this must have been witnessed. There must have been people who came to his aid very rapidly and were able to identify that this was happening and that he wasn't breathing, and were able to give him artificial respiration. And then folks who have this have to be on a ventilator. They cannot breathe on their own. They have to be on a ventilator for the rest of their lives in order to survive, because the Respiratory Control Center can't send those signals down because there's been a complete injury through the spinal cord. They're severing those connections, severing those axons. So I'm not sure if you can tell in this image, but here he is at some kind of big fancy celebrity thing. There's Robin Williams in the background and his wife seated next to him. He is in a wheelchair, and you might see there's a headrest back here because he does not have full control of his truncal muscles to help support even the weight of his head. You can see he's got special armrests for his arms because he's completely paralyzed. And then you maybe can tell here, this is a breathing tube. So that is the tube that's coming from his ventilator. They do make little portable ventilators that would be on a special location on his wheelchair that then is pushing air into his lungs and then letting it back out 12 or so times per minute. So they do have portable ventilators that people can use so they can go out and about and live their lives. Okay, so that's our last case. So remember, anything that causes low oxygen, high CO2, or a low pH, acidity, will trigger increased breathing via those chemoreceptors. So it could be a respiratory cause, it could be environmental, like traveling to altitude, or it could be a metabolic thing, like those acidosis. But other type of signals can also increase breathing rate, like emotional signals and pain signals. Then remember that the Respiratory Control Center sends its outputs, right, sends efferent signals, motor signals out to the muscles of respiration down through the spinal cord. The major ones are C3, 4, and 5, which keep the diaphragm alive. So those are the nerve roots for the phrenic nerve that supply the diaphragm, and all of the other accessory muscles of respiration, those nerves are all coming down through and out from the spinal cord as well. All right, that's it for lecture 14, and I will see you in lab.